what zip code you live in shouldn't be determinative of whether you have access to healthy food. My name is Eric Angel, and I'm the Executive Director of DC Greens. DC Greens is an amazing food and health equity organization in DC. We believe that food is health, food is medicine, food is a human right. I think the biggest misperception is this idea that people don't want to eat healthy, that the choices are on the folks here. We have found that people really have a craving to eat healthy, nutritious foods. It's just they don't really have access to it.
Located in Washington, D.C.'s Ward 8, the Well at Oxen Run is DC Greens' 1-acre community farm and wellness space.
Yeah, the Well at Oxen Run was many years in the making, and it was out of many community visioning sessions, meeting with folks, particularly the folks who live right around the well, to make sure we understood exactly what the community wanted, what would work for them. We harvest more than 2.5 tons of fresh, healthy food that we are able to give away to the community around here. A lot of nonprofits sort of talk about integrating the community into their work, but we really have brought folks in who've really educated us about all aspects of our program. We hope they become kind of the next group of food justice warriors.
My name is Alfonso Jackson. I am on the advisory board, which is the bridge between the community engagement component of the well and the board component, so lifting up community members' voices in those board spaces. The access to nutritional produce is not always easily available, right? Like you might have to walk a mile or two. If you don't have a car, that's kind of hard. I think people equate growing their own produce or vegetables to having like backyard or access to soil in the ground, which isn't always necessary.
One of the many programs that DC Greens offers the community is Produce RX, which is part of the Food is Medicine initiative.
We really want healthy, nutritious foods to be embedded in the healthcare system. Yeah, the Food is Medicine initiative is this recognition that access to healthy, nutritious foods is essential to making sure that people recover from long-term healthcare conditions. The doctor literally prescribes healthy food and fruit and vegetables to patients, and then we provide the debit cards that allow them to purchase those at local supermarkets and the like.
There's the youth guard, right, where we're introducing school-age children to like farm-to-table practices and theories, right, and introducing vegetables into their lives at an earlier age. And I think there's something magical about getting people engaged and passionate about not only growing their own produce, but being introduced to new produce and crops.
Our aspiration is to have no child, no adult be unable to eat healthy, nutritious foods. So it really should be doable in an incredibly rich society in our capital city for no person to go to bed hungry. One quote that I often recite is Martin Luther King, when he was accepting the Nobel Prize, said that he has the audacity to believe that someday people will have 3 meals a day. And DC Green's twist on that is we have the audacity to believe that people should have access to 3 healthy, nutritious meals a day. So it's really amazing to be working in an organization that's moving towards that goal.
For PBS News Student Reporting Labs, I'm Nicole Lee in Washington, D.C.